This is our project on the impact of training testing data ratio on model accuracy in predicting cardiac patients' mortality rate. Hi, I'm Vaishali Jha, and I'm from Evergreen Valley High School.
And I'm Siddhartha Shibi. I'm from Washington High School.
And our mentors are Dr. Sohail Zaidi and Professor Vimal Vishwanathan. The purpose of this research is to learn how to use IBM Watson platform to use machine learning models for medical data. And we use data partitioning ratio, which is training and testing data to find the desired variable as the outcome of the model. In this study, we are using coronary artery disease to predict in-hospital outcomes, and our training testing data ratio rates are 90-10, 80 to 20%, and 70 to 30%. And it has the output of the feature summary, accuracy of the model, ROC curve, and confusion matrix. Our data was collected from the Heart Institute in Punjab, and it had about 15,000 admissions corresponding to 12,000 patients. Some key factors we observed were acute kidney, which is when the kidneys stop working, ejection fraction, which is a measurement of the percentage of blood leaving your heart each time it contracts, and acute coronary syndrome, which is when there's a sudden reduction of blood flow to the heart. Here's some variables we observed. For hemoglobin, the standard deviation is 2.297. Pulmonary embolism is at 0.126, and glucose is at 91.362. What is IBM? IBM is a platform that helps create models to accomplish tasks more efficiently. It processes information quickly, and it has industry-tested protection. It is used for the hardware and software industry for machine learning platforms, such as cloud computing and data analytics. Our data was split into 3 testing data ratios, 90-10, 80-20, and 70-30. And it selected 2 main algorithms, which is XGB classifier and random forest with and without enhancements. And we were provided accuracy, confusion matrix, and feature summary. And a comparison was made for all 3. 3 possible outcomes of the data were DAMA, which is discharge against medical advice, expiry, the death of a patient, and discharge to send a patient when they're able to be in their home. Here's an example of a progress map. This was for the 90-10 data ratio. So basically, it takes our data and it reads the information, then it processes it to select models. And in this case was XGB classifier and extra trees classifier. Then it optimizes the information. Here's an example for our typical 80-20 training test ratio. We are provided with model evaluation, feature summary, ROC curve, and confusion matrix.
So the impact of training testing ratio on model accuracy. Well, IBM chose 3 different algorithms, snap random forest, XGB classifier, and random forest. And of these 3, the 90-10 training testing ratios found that for snap random forest, we found accuracy values of 87.8%, which obviously, as we change the training testing ratios, will change. And for 80-20, we observed that we found an accuracy of 88.7%. So there's a small 0.9% increase. And we can observe that some of these changes are present throughout the different training testing ratios. And for feature summary is essentially a listing of all the different features based on contribution, and loop count, as you can see in the 90-10 case, is the most contributional percentage in the 90-10 ratio. And as it's the most important feature, compared to the 80-20 ratio, where it's seen as a simple 9% contribution to the 80-20 ratio model. So we can see that some of the different features have been swapped around, and there are some different changes based upon this simple data ratio change. 70-30 ratio, we observe that obviously, clearly, there are also some changes. Ejection fraction is seen as 100% contribution compared to the 55% in the 90-10 case and 27% in the 80-20 case. So clearly a huge impact on this changing of training testing ratio. And we also observe this in the confusion matrix. So the confusion matrix simply gives us a breakdown of individual accuracies per specific values. So we found that in the 90-10 case, discharge contributed to 90.1% accuracy in its own individual model output predictions, whereas in the 80-20 ratio, its accuracy lowered to an 89.3%. And a similar impact can be seen throughout the other features in the tables, other outcomes. And in the 70-30, this discharge rate accuracy has gone up to a 91.3% accuracy. So this contrasted with the, again, previous 90.1% accuracy in the 90-10 case and 89.3% accuracy in the 80-20 case. So there's clearly also an impact on the confusion matrix. However, I think the most significant change is probably in the ROC curves. And an ROC curve is simply a simple graphical interpretation of how effective a graph is. So over here, you can see that in our 90-10 case, we have curves which stray from this 45-degree line. And the idea is that the closer a graph is to a 45-degree line, the less accurate it becomes. Meaning that the top left corner is primarily a place where you would get like a more accurate model. And this is observed with the expiry condition in both the 90-10 and the 80-20 cases. However, we can see that the 90-10 case predicts DAMA far more accurately compared to the 80-20 based on the simple graphical interpretation of the curves. In the 70-30 ratio, you can also notice that there are similar changes, and you might be noticing a trend that is that the curves all have their own kind of ranking on this prediction accuracy. So expiry is the most accurate, with discharge and DAMA being less and less accurate in terms of prediction, DAMA especially given its unpredictable nature. So the conclusions of our research found that IBM Watson is pretty successful in creating a model for artery disease patients. The model output monitored as input training testing ratios was changed from 90-10 to 70-30, and a noticeable impact on feature summary was observed. Remember the loop counts? And these certain features contribution fluctuates based on the split ratio, but why, right? So a medical perspective of this change requires more thorough investigation, which is a bit beyond the domain of the current work. Other factors which were impacted by change include the ROC curve, confusion matrix, and essentially the accuracy of the model. Another observation is that algorithm selection by IBM machine is also sort of determinable, as more work is required to understand why certain models were preferred. For example, in the 90-10 case, we had XGB as opposed to some other sort of machine learning algorithm. So for future work, obviously our research shows that data splitting ratios do have an impact, and that does play a prominent role in such as outcome and accuracy selection. So the variation is important in predicting set outcomes and requires further research. So for future research, we are looking for data from other fields or other sources in the same field. For example, our data was sourced from Punjab, a heart institute in Punjab. So we might look forward to other locations or whatnot in order to get a broader perspective on the impact of varying training and testing ratios. And that's our presentation. Thank you for listening.
Thank you.
Yeah.